SinusTrigger. So to start off with, we need to get the room set up. And for this exam, it's pretty easy. You just need to detent the tube like you do for any other exam. So this is off center. We're going to bring it to center. Line it up with the bucky. There it is. It's all detented. We have a happy green light here. We're at 40 inches away from the bucky. And that's all set to go. So follow me over to the console. So we have our fake patient here. We're selected on the wall bucky. There's a grid inserted, and then we have our sinuses all lined up, ready to go. We just, select the one that we want to work on. And the technique is roughly what we're going to be using, 85 kVp for all of them, and then we'll kind of fluctuate the mass as needed. So we'll start with 7.1 for now, and that's about it. Also for the bucky, we're using a DR plate, so we won't be needing to switch out the IRs or anything, but for sinuses you can use an 8x10 or a 10x12. And for all of the projections, when you do take the image, it's just going to be hold your breath or suspend your breath for all of them throughout, and all of them are at 40 inches. So we're ready to go. Sarah Smith. Hi, I'm Sky. I'm from X-Ray. I'll be taking your X-rays today. Can I get your full name? Sarah Smith. And what's your birthday? October 2nd. Okay. And is there any chance that you could be pregnant? No. Okay. Are you wearing any jewelry or necklaces or anything like that? Any metal in this area? No. Looks like you're all good. Okay. So what brings you in today?
I fell and I really hurt my face, and the doctor thinks that there's something wrong with my sinuses. Wants to make sure that everything's okay.
Okay. Is there a specific side that hurts more than the other, or that's more affected?
Maybe my right side a little bit.
Your right side. Okay. Well, let's go ahead and take a seat here. We'll start our first projection. I'm just going to put the shield here for now. So for the first projection, we're going to be doing the PA axial projection of the sinuses. It's the Caldwell method. And for this one, the bucky is going to actually be tilted 15 degrees. Just about there. A little bit. Okay. So for my patient, I'm going to go ahead and have her facing the board here. Go ahead and get nice and close. And your forehead and your nose are going to be touching the bucky. And before all exams, make sure that you wipe down the bucky really nicely, just to make sure that we're not spreading any bacteria or anything like that. Make sure it's nice and clean for the patient since they're putting their face on it. And so for this projection, we're going to go ahead and shield the patient. And the OML is going to be lined up perpendicularly with the IR, but it's going to form a 15-degree angle to the X-ray beam. And for most of these projections, we'll just have the patient seated. It's a little bit more comfortable, and also in an upright position for all of these exams and studies, because it just helps to see the air fluid levels in the sinuses. So that's very important to do. So the central ray is going to be exiting the nason, which is in the middle of the eyes, kind of where the bridge of the nose meets the forehead. So let's see where we are here.
And so I'm going to raise the bucky up a little bit. Right there. Okay? Just a little bit more.
So I'm collimating it to an 8x10 for this projection. Looks like everything is included. You want the frontal sinuses in there, the ethmoid sinuses, the sphenoidal sinuses, and the maxillary sinuses for all these projections. Make sure that you mark the correct side. Okay. And so for this one, the technique would be about 85 kVp and 7.5 mass. So Sarah, go ahead and take a nice deep breath in, and then just hold your breath. Okay, expose. And so, next what we're going to do is have Sarah move back just a little bit. There you go. Because we're going to return the Bucky to its upright position. Vertical. Turn that down a little bit. Okay. Okay, so the next projection that we're going to be doing is the parieto-acanthial projection. It's the Waters method. And so for this one, the beam is horizontal, once again. And for this one, we're going to have the patient tilt their chin up so that the OML forms a 37-degree angle to the IR, and the mento-meatal line is going to be pretty much roughly perpendicular to the IR. So go ahead and get nice and close. There you go. Tilt your head back. There you go. A little bit. There. All right. And so for this one, the central ray is going to be perpendicular to the mid-sagittal plane, and also exiting the acanthion, which is just underneath the nose. And so for these two projections, the PA axial Caldwell method and the parieto-acanthial Waters method, they're both going to be centered to the mid-sagittal plane. Make sure that that's lined up. No tilting of the head. And that is all set to go. Make sure they're shielded once again. And the technique for this one is going to be 85 at about 8 mass. So, Sarah, just hold your breath and expose. Okay. So for the next projection, we're going to be doing the lateral projection. And the patient is just going to be in an RAO or an LAO, depending on the side, if you're doing both of them versus just a single side. So in this case, we're just going to be focusing on her right side of her sinuses, because that is where she said that she is feeling the most pain. So I'm taking my left marker off, and I'll be putting my right marker on because that's the side that's closest to the Bucky. Okay, so still facing the Bucky. Go ahead and just turn your head to face me. And make sure that the interpupillary line is perpendicular to the IR. So just to make sure that there's no tilt. Good. Okay, and so for the central ray, it's going to enter 1/2 inch to 1 inch posterior to the outer canthus, so about where the temple kind of is. I'm going to have you back up just a little bit. Right there. And then tuck that down. Okay. And the shield is going to be placed behind here, the patient here. And I'm just going to collimate in a little bit for her. So for the technique for this one, it's going to be 85 kVp at about 3 to 4 mass. So Sarah, just hold your breath. X-ray. Okay, so the next projection is going to be the submento vertical projection, and we have a horizontal beam still. For this particular projection, the patient is going to have to tilt their head really, really far back so that their IOML is perpendicular to the IR. So it's going to be pretty far. And then the central ray is just going to enter about 3/4 of an inch anterior to the external acoustic meatus. So that's just right in front of the ear. All right, so I'm going to take this shield out of the way because I'm just going to be facing the tube this time. There you go. Right across your lap. And put your back against the board here. And then you can also have them kind of scooch the stool up a little bit so that it's easier for them to kind of go back. And the vertex of their head's going to be touching the Bucky. There we go. So I'm going to drop this down. So just watch your head.
still her right side. A little, tiny bit more. Okay.
Make sure that her mid-sagittal plane is lined up with the bucky perpendicularly. Sorry, hold on. Okay. Everything looks good. Okay. So for this projection, the technique would be about 85 kbp at 14 max, and we are ready to take the image. Okay, Sarah, hold your breath. X-ray. You can go ahead and relax. So that's the most uncomfortable projection out of all of them. Once the patient is done and dressed and ready to go, come back, make sure that you wipe down the boards and everything so that the next patient has a nice clean area to have their exams. All right. First, we will be looking at the PA axial projection, or the Caldwell method, and it's important to collimate down to the sinus area and adjust your technique according to the brightness and contrast to be sufficient to visualize the air fluid levels if there are any. This particular projection is used mostly to show the frontal sinuses and anterior ethmoidal air cells. You want to make sure that there's no rotation or tilt, and you can tell if you've got that correct, if the petrous ridges are symmetric on both sides and the mid-sagittal plane of the head is aligned with the long axis of the collimated field. There also needs to be equal distance between the lateral border of the skull and the lateral border of the orbits. The frontal sinuses should be above the frontonasal suture, and the anterior ethmoidal air cells should be above the petrous ridges. The second image we will be looking at is the parieto-acanthial projection. This is also known as the Waters method. And for this one, you need to collimate down, just like the other one, down to the sinus area, and make sure that you adjust the technique so that if present, you can see any air fluid levels with enough brightness and contrast. You want to make sure that there's no rotation or tilt, kind of similar to the other one, as long as there's equal distance between the lateral border of the skull and the lateral border of the orbit on both sides. You know that you've positioned correctly. The orbits and maxillary sinuses also should be symmetric on each side, and the mid-sagittal plane of the head will be aligned with the long axis of the collimated field. You also want to make sure that the OML is in proper position, so you need to bring their head back enough, and you'll know that you have positioned correctly for this one if the petrous pyramids are immediately inferior to the floor of the maxillary sinuses. This projection shows the maxillary sinuses the best, but it's not very good for the frontal and ethmoidal air cells because they are distorted. So you can also see the foramen rotundum in this projection. The next projection we will be looking at is the lateral projection, and you want to make sure that you collimate down to the sinus area and adjust your technique so that you can see air fluid levels if they are present. This projection shows all four sinus groups, but the sphenoidal sinus is best demonstrated in this particular projection of the sinuses. You want to make sure you have no rotation or tilt, and you can check to see if you've positioned correctly by checking to see if the sella turcica is in profile, that the orbital roofs are superimposed, and that the mandibular rami are also superimposed. This projection is especially useful in showing the relationship of the surrounding structures and kind of the thickness of the outer table of the frontal bone. And it can also be used in preoperative measurements, but for that you would want to use a 72-inch SID to minimize magnification and distortion. The last image we will be looking at is the submento-vertical projection of the sinuses. You want to make sure once again that you collimate down to the sinus area so that you can see any air fluid levels if they're present, with enough contrast and brightness to see them. Be sure to position the patient so that there is no tilt, and you can check if you've done this correctly if you see that there's equal distances from the lateral border of the skull to the mandibular condyles on both sides. You also want to make sure that the IOML is positioned parallel to the IR, so bring the patient's head back pretty far. You can tell if you've positioned correctly for this if there's superimposition of the anterior frontal bone by the mental protuberance, and also if there is inefficient neck extension, it will cause the mandible to superimpose the ethmoid sinuses. The mandibular condyles should be anterior to the petrous pyramids. This projection shows the sphenoidal sinus and the ethmoidal air cells the best.